Even as coronavirus cases spike, when it comes to school, the American Academy of Pediatrics says all policy considerations for the coming school year should start with a goal of having students physically present.
Kids need to learn, and they learn better in person than they're going to learn virtually.
Leslie Saba agrees. Her son really struggled with distance learning.
He missed that interaction so much, and he missed the instruction. He didn't care to just sort of read something and do something.
The AAP worries that without going to school, kids lose access to behavioral and mental health services, food programs, and are socially isolated. And students without internet connections or devices are falling behind. But parents like Renee Parker in Houston see things differently.
I will not allow my kids to go back to school in August, in the fall.
No matter what?
No matter what.
One of her daughters has an autoimmune disease.
My kids missed all their friends, but at this point, we're talking about their health and their lives. I think safety comes first.
The AAP suggests kids could be as close as 3 feet apart, particularly if wearing masks, assigned seating on school buses, doorways left open so no one has to touch the knob.
Some are going to look at this and say, why would you put kids at risk?
Yes, there are risks associated with COVID-19 and getting COVID-19. Those risks are lower for children, but we also have to take into account all the other risks of not having them in school.
Schools and states will ultimately make their own decisions. Many are considering some in-person and some remote learning, but the nation's pediatricians wanted to make it clear where they stand. Kate Snow, NBC News, New York.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.